I hear the word menopause and I think out to pasture.
Right.
You're done.
And I thought that for a long time too. And then I'm Gen X. You know what? To hell with that. I want to live a good life. I want to feel like I can go to the gym. I can play with grandbabies. I can roll on the floor. I can climb a mountain. I can run a company. I can do all these things. And I'm refusing to just accept the medical definition of getting older for a woman, which is very different than a man. So when we're born, we have about 1 million plus or minus eggs. So from birth until we die, we're slowly losing that egg count, and it starts accelerating as we get older. So by the time we're 30, we're down to about 10% of our egg supply.
Well, hold on a second. By the time you're 30, you've already lost 90% of the eggs that you were born with?
That's correct.
I don't know why I never knew that. I kind of feel sort of dumb that I've gone through 55 years of my life, and I did not know that we're down to about 10%.
And at 40, 3%.
3% at 40?
3%. Mm-hmm.
Wow.
Yeah.
And you lose your period because you have no more eggs, so there's no more need to go through that cycle.
You can't ovulate. So, yeah. There's
Holy
nothing
cow.
left. But doesn't it make sense now?
Of course it makes sense.
Why it's harder to get pregnant when you're older, why you're more likely to have a chromosomal abnormality, because the number and quality of your eggs is declining with age. What happens for females is that our endocrine system, especially the ovaries, age at twice as fast a rate than the rest of our body. The endocrine system is where our hormones are created.
Okay.
All of our estradiol, our progesterone, and about at least half of our testosterone is created in those ovaries every single month, every single day. However, when we get to perimenopause, things start changing. And when we get to full menopause, we have no eggs left. The ovaries decline. We're losing our ovaries at the average age of 51. They stop producing sex hormones. And we basically are forced to live the last third of our lives without the benefit of estrogen, progesterone, and about half of our testosterone.
I get this at a level that I've never understood this before. Because when you really just put it in the context of you're born with 1 million eggs, and from the moment you start your menstrual cycle and the hormones are going up and down, there is a purpose associated with the design of your body. And once that stops, everything gets disrupted in your body. Oh, why has nobody studied this? What the hell?
People are studying it. When we look at OB-GYN, the residency.
And that's what you
women's
are, right?
Health. Yes, I'm OB-GYN, women's health. Super proud of what I learned in my training.
Right.
Pediatric gynecology, oncology, surgery, babies, fertility, all this stuff. Menopause got shoved in this tiny little box. Like, she's going to have a few hot flashes and maybe some vaginal dryness. Her bones might get a little weaker and that's it. Oh, we only want to give her estrogen if she can't tolerate anything else. If nothing else is working, then fine, give it to her. But, you might kill her.
Wow.
Mm-hmm.
Wow.
Our bodies thrived on this hormone.
Right.
For 50 years, 51 years on average.
And by this hormone, you mean estrogen.
Estrogen.
Okay.
And testosterone and progesterone. We were living our lives, managing our stress, managing our weight, doing all the things. Mm-hmm. And then all of a sudden, you can't put your finger on it, but something's changed.
That's exactly what everybody says. And whether this is happening to you or you've heard your sister or your mother or your partner say this, we start going, I'm doing the same stuff I've always done. Mm-hmm. Like my pants are not fitting. I am grouchy. Suddenly I feel like I have ADHD or brain fog or dementia. Mm-hmm. I don't feel like myself in my body.
You are every single patient who comes to my office. This exact same story.
What would you, as a gynecologist, do when a woman would come in, as they did for years and years and years before you became one of the world's leading experts in this? What would you do as a doctor?
I'll tell you a story from my training. So we had gynecology clinic in residency, and I was an intern. And so we had, OBs divided into 2 sections. And so in gyne clinic, we had, the surgical cases coming in. And so all the residents would line up, like 6 or 7 of us, and the upper levels would run for the surgery cases because they want to operate, right? Mm-hmm. And us interns would be left with whatever was left. And they'd be like, oh, You got a WW.
A WW?
A WW in room 12. Good luck with that. And a WW, this wasn't written in the chart. My professors never said this. This was kind of lore handed down from upper level resident. And you can do it with a Texas accent because that's where I trained. So these guys in cowboy boots walking up and down the hall. Hey, you got a WW in room 12. Good luck with that, you know. And it meant whiny woman. So here was this woman coming in. And this was a public health hospital, you know. So she's desperate.
Yeah.
She can't sleep. She's gaining weight. She's not happy. She's having maybe headaches. I mean, just this kind of laundry list of very vague complaints. But she was still having periods.
Yes.
Maybe irregular, maybe heavier, maybe lighter, maybe, you know, and just this, and you were like, oh, it's just part of aging. If she came in complaining of libido, I was a deer in the headlights. Like, I didn't know what to tell her. Like, we were taught nothing about the female sexual response or medications that might help, or, you know, go out and have some wine, relax, get a new boyfriend, you know. All the other complaints, I would start sending her to other specialists. Like, let's go see a cardiologist for the palpitations and the, you know, a neurologist for your headaches and the, you know, and she'd walk out of my office with 6 referrals, and I didn't know enough to say, let's try some hormone therapy and see if these things get better. I'll do some blood work. Let's make sure it's not autoimmune disease or hypothyroidism. I was doing that. I just think back on that and that we can do so much better. We got to do a better job training every single healthcare professional in all specialties about how special menopause is and what the lack of estrogen is doing to each and every organ system. Each female has a unique expression of our menopause. So where you may have had palpitations, frozen shoulder, and dry vagina, I would have had hot flashes, night sweats, and horrible rage. And, you know, doctors like a checklist of symptoms.
Yeah.
That's how we're trained to recall, you know, but we're trained to look for ducks. How does it? Does it walk like a duck, talk like a duck? It's a duck. And everyone's duck's a little bit different.